general assessment of the adolescent patient will in many ways be very similar to that of an adult. If the patient has gone through puberty or is in the stages of puberty, while you're doing the examination, many of those things are going to be equal to an adult, such as body shape and size, body habitus, as well as heart rate, blood pressure, respirations. Those kind of measurements should be equal to that of an adult. The pain measurement scales will be equal to that of what you would use on an adult. Some of the differences in the adolescent population, they are of course striving to be independent and their own person, so you always want to try and direct as much of your assessment and questioning to that patient as you can. It's not always possible, and there are items that a parent or guardian will have to answer. So that's one key thing to be really cognizant of when you're doing your assessment with the patient. At this age, bullying and peer pressure is a very large issue, so it's a very important part of the assessment to make sure that you are asking them, how is school going? Are you having any problems at school? And ask them about their support group. Do you have some really good friends at school, or at home that you can share your concerns with? Because as we all know, adolescent children aren't always that great at sharing things with their parents. In addition, what kind of support do they have at school? Is there an adult that they feel like they can trust, that they can go to if they are having issues, whether it's a coach, a teacher, a counselor, a member of the church that the patient is comfortable going to? Just make sure that student has, or that young adolescent patient has somebody that they can go to. Of course, their parent, obviously, but it's always good to have somebody else that they trust, that they're comfortable, that they can relate to. You want to ask again about the bullying and peer pressuring, see if there's anything that needs to be resolved about that, as well as you always need to ask your patient if they feel safe at home, and if the patient does not and mom or dad are there with them, they may feel intimidated and not able to talk, so you really need to be watching your nonverbal cues. Are their eyes downcast? Are they able to meet your eyes? As well as looking for bruising during your assessment to see if the patient appears to be okay. Overall, assessment of your adolescent patient should be a pretty fairly straightforward process.